I'm going to give you the view from Scotland, but as looking around the room, everyone looks very trustworthy. I'm going to tell you the truth. I'm not going to tell you how wonderful everything is, because we haven't got it sorted, far from it. But let me just share a few facts with you. This is Scotland. Population is 5.3 million. Health has devolved to the Scottish Parliament. So in fact, the NHS in Scotland is completely different to that in England. As you will know, England has gone down the route of trying to improve quality and services for patients through market competition. Whereas in Scotland, we're a kind of benign Stalinist society who goes down principles of mutuality, partnership, and rewarding on quality outcomes, not rewarding on inputs. And what we're doing now is we're involving our citizens in determining what those outputs are and how we measure them as we integrate our health and care system. And Scotland has got every challenge known to man and a few more besides. We have got, like Ireland, we've got challenges with remoteness and rurality. We've got challenges of large urban populations, very dispersed communities. But also in the east end of Glasgow, we have got the post-urban deprivation issue. As you know, we have probably the worst statistic in the world for male life expectancy in one postcode in Glasgow, which is shorter than in the Gaza Strip, which is nothing to be proud of. So we have all of that to tackle. This is the vision for the NHS in Scotland. We're one of the few health systems that can actually put its vision on one single slide. And what we're saying is this: everyone needs to live longer, healthier lives at home. We're going to do that by integrating health and social care. We're going to focus on prevention, anticipation, and supportive self-management. We recognise hospitals are dangerous places. People die in hospitals. People often die in hospitals of conditions they didn't actually have when they went into the hospital in the first place. So if you do need to go to hospital, it will be for as short a period of time as possible, and we will look to get you back home or into a homely setting with little chance of being readmitted. Now, no one can disagree with anything on that slide. In fact, most healthcare systems round about Europe, and including Estonia in this, and actually in Ireland here, will actually use these words, but maybe in a different order. But most of them will be there. But the reality, we cannot deliver those the way our services are configured at the moment. So what are the drivers for change in Scotland? Well, demand from our citizens. The financial challenges, which are all too real to everyone in this room. The fact that politicians actually want change, but then when you try to close a local health facility, will fight tooth and nail to keep it open. But actually, we've got a very informed political system in Scotland. I'll talk a little bit more about that later. And we are legislating to actually put change through. So health and social care integration is actually law passed and signed by the Queen. And by 1st of April 2015, we will have a fully integrated health and social care system. But the drivers within our system are about innovation, the drive for quality, the drive to tackle those inequalities I talked about earlier. But the most important and liberating one for us is co-production, working with our citizens and with our communities to actually shape, design, redesign, and implement health and care solutions. So all of you will be familiar with this, the demographic change across this country, my country, and across the whole of Europe, taken with the increase in long-term conditions, the fact that we're absolutely hopeless at planning doctors and nursing and physiotherapy numbers, that we've actually in Scotland got a shortage of some specialist doctors, and we actually have had a shortage of nurses. And it's like turning an oil tanker. You can't just turn that tap on and off at 5 minutes' notice. The financial crisis globally has affected all public services around the world, and Ireland is very familiar with those challenges, as are we in Scotland, although our health service has been protected by no cut in budget. In fact, it hasn't had any significant increase in budget, so in fact, as inflation continues to go up, the amount of money available actually does begin to reduce. And then the issues of health inequalities, but for me, the big challenge is people are living longer, and it's not about life expectancy as being successful now, it's about healthy life years. How you can be active with a good quality of life, or as good a quality of life as you can expect for as long as you're on the planet. That's what's going to happen in Scotland. By 235, 82% of our population are going to be over 75. And if anyone else tells me about the demographic time bomb and tsunami, as though those are the group of citizens that are going to sink our health and care system, I will scream. They are not. For me, the challenge is these people need to remain active. They need to remain economically active. They need to remain active within their communities because they are a huge resource that we need to continue to tap into to support us as we move forward. They are not a problem. But that's our reality, everyone in this room. The number of people who are going to require care over the years to come is going to continue to increase, and those able to give that care are going to reduce in the formal services land. And if you remember nothing else, that is our reality across Europe. But I'm not going to do the motherhood or the apple pie bit. You like that? It took me ages to get those slides. I'm going to use them again. In fact, that looks quite a nice bit of apple. That's the reality here, Scotland, and around Europe. People are having to wait longer for care. People are being taken to hospital more often than they need to be, more often than they want to be. But hospitals tend to suck people in because that's what they were designed to do. So we reckoned it was time for change. But the reality, and your reality and my reality, is the way health services are delivered in Ireland and in Scotland today is no different than it was in 1948. People still go to see the doctor. People are still sent to the hospital. Community nurses will visit and do things to you. That model is not sustainable. So what we did is we went and talked to our population. And as a cynical doctor, I was absolutely surprised what they told me. Probably no surprise to you guys, but this is the reality. People said they wanted to give things back, but didn't actually know how to. They wanted to care for others, but found it difficult to do so, either because their elderly parents, for example, lived at a distance away, or both partners were in full-time work and were time poor and were scared that they weren't able to do enough. They recognised the resilience in their communities. They liked the stories, if it was snowing, if there was flood, how people in the street all got together, dug out the street, looked after the frail elderly lady who lived in her own. But they no longer wanted that just for 5 days or 10 days per year. They wanted that all year. They actually regretted the fact they were now only on nodding terms with the other people in the block of flats they shared or with their next door neighbour, that they didn't know anything about them. And when they looked out that window and they saw an ambulance 3 doors up and someone being taken out in a stretcher, they felt slightly guilty. Slightly guilty that they didn't know someone had been in trouble, because if they did, I could have gone and helped. That really surprised me. They wanted to share skills and experience with others. They wanted to be better connected to their communities. And actually, they wanted to use technology more. They wanted the technology designed to be simple, and they wanted taught how to get the most out of it. Now, we believe that technology, appropriately configured, can actually support all of those other things. Now, we've had an e-health strategy in Scotland for many years, but overarching everything we do is something called our quality strategy. And what it says is this: any change to health services must tick 3 boxes. It must be safe, must be effective, but most importantly, it must be patient-centred. If it doesn't fulfil any of these criteria, we will not do it, it will not be supported, and it will not be financed by our government. But behind that strategy are a number of delivery organisations, and I lead one of them, which is called the Scottish Centre for Telehealth and Telecare. It was set up by Scottish Government in 2006, so we're kind of 8 years old, but we merged with the Telecare, that's the assisted living, which sits with the social work department in 2011 to make an integrated centre for telehealth and telecare. And the first thing we did when we set up the organisation, we asked our government auditors to look at the use of technology. And it was the best thing I ever did. People thought I had 2 heads. You know, it's a bit like asking someone to come into your house who's got burglar written across their chest. and we tend to keep these people at bay. But I brought them in, and it was incredibly helpful, because this is what they told us. The NHS was facing growing demands for services, and our health boards had to consider new models of care, including telehealth. They actually said that using these technologies appropriately could actually deliver a range of clinical services more effectively and efficiently. That wasn't me saying that. I've got a vested interest. That's our auditors said that. And they basically said that if you're redesigning your services, you need to consider telehealth. But if you're going to use it, it must have a robust business case around it. So treat it as you would treat everything else, not as a luxury, not as an add-on. Because what we had in Scotland is we had hundreds of pilots of technology deployment. In fact, there was more pilots than British Airways have pilots, of 20 patients here and 15 patients there and 7 patients over there. And we decided we were going to stop doing that. Standing next to Brian, we also said we're going to stop doing randomised controlled trials of technology deployments into communities, because randomised controlled trials in this environment don't work. And now the main researcher of the whole system demonstrator in England has actually stood up and actually agreed with the position I took way back. Not just me, I mean, I now take credit for it. I'm like that, so my wife says. Don't anybody tell her. I'll get hell when I go home. But what we've always found is we tend to use technology on top of conventional services. And therefore, when you evaluate them, you find that it's always more expensive. Because what we need to do is we need to stop doing things the old way when you start doing things differently. And we're going to hear from our colleagues from Estonia, who really have to be admired in what they've done in the role of ICT in health. So what we did, we said we were going to do 4 national programs. This was 5 years ago. We were going to use technology to support the management of stroke, so we've now got a national service for supporting thrombolysis, the administration of clot-busting drugs, across the whole of Scotland. We've got an unscheduled care paediatric video conferencing service in place, long-term conditions management and mental health. These were our priorities 5 years ago, and we put national programs in place. We no longer have a strategy for telehealth and telecare. We have a delivery plan. Strategies go on shelves. Delivery plan sets out targets for the health service, and it says we will deploy technology to support 300,000 of our citizens when it is safe, effective, and appropriate to do so. Because what we are saying is this: the most important resource any health and care system has is face-to-face contact. Ladies, when a man is sick, you know, part of the cure is they have to tell you, you know this, how sick we actually are. Yeah? Okay. It's fundamentally important. Everybody thinks we're about getting rid of doctors, getting rid of nurses, getting rid of therapists, and replacing them with technology. Our delivery plan doesn't say that. It says it's going to make face-to-face care more accessible to people when they require it and where they require it. But we will use every digital channel available to us to service the needs of our citizens when it is appropriate to do so. Just because you can use technology doesn't mean you should. It's about common sense. We're going to use 3 devices to interact with our citizens in Scotland. We're going to use smartphones, we're going to use tablet-type computers, and we're going to use digital televisions. And I can tell anybody who's interested in why we put digital television in there at lunchtime why we've chosen digital TV. But it's never about the technology. It's always about the service design. If you get the service redesign wrong, it doesn't matter how good the people are or the technology is, it won't work. And we've got examples in Ireland, we've got examples in Scotland, we've even got examples in Estonia, I'm sure, where we've actually got it spectacularly wrong. But we need to share our mistakes and learn from them. We don't need to make the same mistake in Ireland that we made in Scotland last year and Estonia 2 years ago. We need to collaborate and work together and be honest with each other. But actually, it's not really about millions and millions of euros. It's usually about small amounts of money, because that's what the health service is like in Scotland, just like it is everywhere else. There is not enough money. This is a project I just want to share with you for 2 minutes, and then I'm finishing. This is a co-design project. We're co-designing with 8,000 of our citizens. Yeah, that's right, 8,000. 80,000 citizens in Scotland are helping design this web-based project. It's about delivering choices in health and care and well-being for initially 55,000, and we're now going up to 80,000 citizens. And it's to address everything that our citizens told us they wanted to do is included within the Living It Up project. That, by the way, that is not the two pandas that we have in Edinburgh Zoo. Mind you, it could be, that might be the reason they never got pregnant, in fairness. But the other interesting thing is that we've got more pandas in Scotland than we have Conservative members of Parliament. Just another interesting fact for you to take away from here. But it's all about collaboration because, ladies and gentlemen, I will make another admission to you, as I don't know most of you in the room. For too long, I as a doctor thought I knew best as to how to redesign services that you would want to use. What a mistake that has been. 25 years down the Swanee. Listen to patients, listen to service users, listen to families, listen to carers. They won't simply articulate the problem, they will actually articulate the solutions if only we listen. And that's what we do now for all our projects. And this Living It Up programme has got 27 different companies involved in it. Small companies from Scotland, large international companies, all working together with service users, patients and carers organisations, with local authorities, with health service specialists, managers and so on, to design this service. And it's all about this, because I firmly believe the salvation for our health and care system is this. We need to unlock the creativity, skills and experience that each of us has within ourselves and make that available to you as a citizen, but to the people round about you. We need to unashamedly pay on the fact that communities want to give something back and empower them to do that and make it easier for them to do that. And I firmly believe appropriate design of technology will do that. When we looked at technology investment in Scotland, I won't go about the money, but what we found is that 95% of all technology investment was either done to benefit the healthcare organisation or the people that worked in it. And very little was directly benefiting patients. Our investment now is sitting about 50 to 55% patients and 40 to 45% on organisation and healthcare professionals, and we're committed to move that further. Because the last thing we want to do is, through the deployment of technology, lock people in behind their front door and get a tick in the box because they're still in the community. That's not what it's about. Now, this slide is not here to say that we're all going to get old and we're going to walk lovingly into the sunset. This actually shows you it always bloody rains in Glasgow. Thank you very much indeed.